When I first met him, he had just come off a week-long hospitalization on the East Coast because he'd had terrible side effects from chemotherapy. When we first met him, his prognosis was less than a year. And I met with him and his family, and he told me he had two goals. One was to have a better quality of life, and two was to live as long as he could. So I worked with him to get his symptoms under control. We cleaned up his medication, got him the chemotherapy treatment and eventually radiation therapy treatment that kept his pancreatic cancer under control. And he had a pretty good quality life for actually 2 years after I met him, and was able to live his life with his family, and he ended up dying at home with hospice care. He had intermittent home palliative care during those 2 years. And I feel like together we really worked to make sure that he had the best quality of life possible for those last 2 years of his life.
From a medical standpoint, we spend a lot of time learning about treatments and pathology and medications, and it seems like we sort of get away from the human side of things. And palliative care sort of brings that element back.
Palliative care is all about helping the individual and their loved ones live the life they want, make the choices, make the decisions, and then get the support they need to carry out those wishes.
It comes down to really trying to understand what patients need. And those needs aren't always what you think they're going to be. But it's really about understanding what compassion means, I think.
Palliative care gives you a real opportunity to make a difference, but importantly, in a way that's most meaningful to the patient and the family. They share with you what would be important in you trying to live on.
This really involves getting to know a family, getting to know a patient, and really knowing what their desires are, their choices are, and respecting that.
Palliative care is a team of experts who look at the whole person, the whole package, and say, your quality of life is not what you want it to be, how can we make it better for you?
I think it really gives people a voice. I think that a lot of times patients and their families are kind of just going with the flow of things and following what the doctors are recommending and not necessarily thinking about a choice. It's important for families to know that they have a lot of power in what happens and what direction we go with what we do for their families while they're here at the hospital and then after they leave.
So Mr. Smith was a 85-year-old guy with moderate dementia. He was kind of doing okay at home until he fell and broke his hip. He was in the rehab facility and struggling. When we sat down with the family, they helped us realize who this person was, and he was the leader of their family. And they loved him dearly, and they were shocked to see what he was going through. They didn't know that they had the option to say, let's focus on his comfort and treat him with dignity as he is dying, rather than trying to prolong his life and get him through this to a place that he probably didn't want to be.
The LQI curriculum provided reading materials and training specifically to palliative care, looking at things like symptom management, looking at pain, how to titrate pain medications for an individual, how to deal with nausea, which can be a very difficult symptom to manage. I probably use something I've learned from this curriculum and this elective on a daily basis.
The nice thing about the palliative care rotations that our second-year students do is that it's very relational. It's all about our students coming to understand that caring for patients is really about relating to patients. Many of our students, this is really the first experience where they see this intersection of suffering and compassion.
They become better at communication, about eliciting of patients' goals, understanding what's most important to the patient, and realizing that it's important. That communication piece is just as important as knowing what the book says to do when treating patients.
One of the things I love about LQI's direction now is we traditionally have always been in the business of educating our professionals in the community, and we continue to do that, and that will continue to be important for the decades to come. But LQI is also doing something new now, which is to work with systems to design better models of integrated palliative support. As we learn from those models, it will allow other people to replicate some of that work. When people have gone through that process, they'll often look back and say it was one of the most important things I did with my family people describe the way their relationships changed as they got more comfortable talking with their families about the things that would be important to them if they were to get sicker. And in sharing, they furthered their relationships.
Since about noon the previous day, he'd been non-communicative, so we knew his time was drawing close. About, 9:30 or 10, we had a call, and the charge nurse came down and it told me that the daughter from California had called. And could I come speak with her? And I said, certainly. So I went and I listened to her, and she said, how's Dad? I explained that he was not communicating with us at this point in time, but that he was comfortable and he seemed to be resting, and was there anything she'd like me to tell him? And I grabbed a little notepad and ended up probably filling about 4 pages of things that she just rattled off. And I listened to all that, and almost tears in my eyes listening to all the things she wanted to tell her dad. So I said, I will go tell him for you. So I went to the room and I touched his arm and I just read off everything that I could remember and kind of looked at the notes. Finally, when I finished, and she wants you to know she loves you. She loves you very, very much, and kept patting his arm. And he said, thank you, Donna. And I just sort of, it just sort of startled me. And I said, if I go get their portable phone, do you want to talk to her? And he said, mm-hmm. So I shot down there and I called her, and I said, he responded. So I said, he may not be able to have the strength to say much to you, but he wants you to know that he heard everything you had to say. So I went in and I got it, and I told him I had her. During the entire time, I could just hear her talking nonstop. And it was just, it was just like she had just poured out her heart to me. She was doing that for her father. And, apologizing that she wasn't going to be there in time, but wanted him to know how much she dearly loved him. And as she talked, I could hear the voices occasionally. And finally, I heard him say, love you too. And I listened, and she was crying, and I said, are you finished visiting with your dad? And she said, yes, thank you so much. And I was so thankful that I had had the opportunity to watch that for a family.
Palliative care, it's all about giving patients and families a voice.
It's about the quality of life.
The quality of life.
It's about the patients.
The patients.
It's about compassion.
Palliative care is absolutely about living.
Many people step back and say, well, isn't that just good medical care? And I say, exactly.